Okay, welcome everyone to our new website, AngioConnect. Right now we're going to spend some time talking about spider vein and how to optimize the cosmetic outcomes on the spider vein treatment. We're talking about that for the next 12 to 15 minutes. This was a presentation that we did on the CVC 2015. This is our disclosures. Considering that lower limb varicose veins and telangiectasias are presented in almost 80%, if you consider some time of telangiectasias, and in Brazil we have at least 95 million people with these casualties, and that gives us something about 190 million legs to treat. The aesthetic market in Brazil is growing. It grew 128% in 2013 and something around 77% in 2014, and earning something around 136 billion Brazilian reais, something that it is 45 billion US dollars. And where are Brazilian women more willing to invest their money? Of course, most of the women are very concerned about their abdomen, hair, and buttocks. But in Brazil, 29% of women will to invest their money in the build of the legs. So if we talk about 45 US billion dollars and 56% are spent on treatments, that give us 25 billion US dollars spent on treatments. If 29% of women are willing to invest the money in their legs, so we have at least 7 US billion dollars to search in the treatment of the bit of the legs. So in the United States, the top dermatologic procedures in 2013 included vein treatment and sclerotherapy, something around more than 200,000 procedures on vein treatment and sclerotherapy. And we've considered how much were expended. Sclerotherapy are also are between the 10 most non-surgical cosmetic procedures in the United States. It's something around more than 100 million US dollars. So the importance to study how to optimize the cosmetic results on the spider vein treatment is because it's important for women, and of course it is also important for economics. But most of the time you found this in the literature. So we have my sclerotherapy technique. So each physician has its medical formula. So how to improve your cosmetic outcome? First of all, you have to prove that you are doing a good job. So photo documentation in 100% of the cases. Why? Because both patients and of course us physicians, we don't remember the initial state of the patient. For instance, this patient came in to the office after 2 sessions of leg vein treatment with transcutaneous laser and sclerotherapy, telling that this was a bad result. So if we compare this for her initial study, we can see that is actually not a bad result, but a very good outcome. So the inability to make comparison in 2 different study points is called subject similarity. And to avoid it, we have a documentation. So photos. To standardize the photographic images, it is essential to make it several times to get used to, and it's the only way to avoid the subject similarity. Of course, nowadays we have devices, apps, and softwares to help us to do this very quick, very fast, and in a very standardized way. So after we prove that we are doing a good job, we have to make a good diagnosis. Why? If you consider class 2 and class 3 telangiectasias, we have 46% of GSV or SSV insufficient associated to that. And considering a C2, 80% of the limbs show some kind of reflux. And most of the time in the GSV are both GSV and SSV. In the lateral thigh, we also have to consider that reticular veins in that area have contact or have communications with the deep venous system. And more than a half of the resistant or resilient telangiectasias are connected to a perforator vein. So the relevance of a subcutaneous vein feeding a spider, we can demonstrate it using augmented reality or any kind of device that help us to improve our vein visualization. Like this, you can see that spider veins right there are fed by this reticular vein. And the relevance of ultrasound when we have resistant telangiectasias. Here we can see that we have a subcutaneous reticular vein feeding the telangiectasias. But when we perform an ultrasound in mode B, we can see that these reticular veins goes right through a perforator. So in this case, of course, we cannot have a good outcome without treating this perforator using whatever you need. In my case, I will probably use phone sclerotherapy. So this is a good algorithm to approach cosmetic leg vein. If we have presence of varicose veins, we perform ultrasonography. If we don't, we seek for a reticular vein. If we find a reticular vein with significant symptoms, we go to a ultrasonography. And if you have only spider vein, we can ask if we have symptoms, go to ultrasonography. If not, sclerotherapy. And right there, if we have reticular veins without symptoms, we can go for phone sclerotherapy, or if you want to, a phlebectomy for these reticular veins. In my case, I will probably do transcutaneous laser with liquid sclerotherapy. And if we do have a reflux from saphenous or a perforator, to achieve a good result, we'll probably have to treat this kind of veins before promise a good cosmetic outcome. So after we did a good diagnosis, we go to study and know as many techniques as possible. Because nowadays we have to look for what motive is important for our patient. If the patient is afraid of cosmetic or bad evolution or just symptomatic, with the correct clinical examination, we have the treatment goal. With a ultrasound diagnosis, we can have the technical possibility of treatment and the treatment strategy, and then finally see the possible options to treatment. And of course, should share with the patient these options, and let the patient also decide what is the best way to treat. If in the 90s we had always the EVM, the evidence-based medicine, nowadays we have the shared decision-making medicine. So it considers the patient opinion, and also the responsibility is shared, and the treatment options are discussed with the patient. So we have several techniques to treat leg veins, both cosmetically or physiologically. So we have stripping, thermoablation, foam scleral, liquid scleral, phlebectomy, cryoscleral, radiofrequency, and also transcutaneous laser. This is my office here in Brazil. So you can see that we have several techniques to choose, and depending on what kind of lesion, we choose one of these techniques. So how to improve the cosmetic outcome for spider vein use, transcutaneous and liquid scleral. For transcutaneous laser, we have to seek the correct parameters and settings. Here we have telangiectasias with 6 millimeters spot size, 70 joules per centimeter square. We don't have any kind of result because it is not the correct setting for this vein and this laser. If we change to the correct spot size and fluence, here we can see the vein just vanishing. Same thing with reticular vein. With correct parameters, I used here 7 millimeters spot size, 20 milliseconds of pulse duration, and 9 joules per centimeter square. We see the result right away. Right now we can just see the reticular vein disappearing, just like that. So to treat spider veins with transcutaneous laser, we have to know what are the correct parameters, and also know what parameters our device provides. So with these two answers, we know if that particular telangiectasia is treatable with laser. So with transcutaneous laser, we can improve our result with that. And with liquid scleral, we had to know that sometimes we are not treating only veins, but we're treating small communications with vein and arteries. So it's like a tiny vascular malformation. And if we consider that in the liquid scleral therapy, the most important zone is very near to the needle, and if we know that, consider then the vein diameter, we have a correct vein, a correct concentration of our sclerosant. I probably choose this kind of management that I call progressive management. Here in Brazil, we use dextrose 75% most of the time because it is the most safe sclerosant, but of course it is not as strong as polidocanol or sotradecol. If I can reach the result or the outcome with dextrose, I change to polydocanol or a mix with dextrose and polydocanol, increasing polydocanol concentration if necessary, or change to sotradecol. This is a sclerotherapy, a liquid sclerotherapy session. So to treat spider vein using liquid sclerotherapy, we have to treat better with less complication risks. After that, we go for eccentrical compression. Why eccentrical compression? If we consider that under elastic stockings, we have different kind of compression depending on the height and depending on the region of the leg, and considering that the lateral of the thigh is the where we have less compression, we can consider that we are compressing something in this region right there, and of course it is not a rare clinical manifestation for cosmetic leg vein treatment. So if pressure is force divided by area, let's push in a small area. So it is done with eccentrical compression. Here is a demonstration how a small cotton ball make a good compression. So doing this kind of procedures, we are of course improving our cosmetic outcome. Here a before and after peak. We treated with 2 sessions of transcutaneous laser, is a 1064 ND egg. Only 1 session before and after, another before and after, only 1 session. And this is a better outcome with dextrose 75%, and after 1 management with dextrose mixed with polydocanol, a very good improvement. So this is the management increasing the power of the sclerosant. But of course, dextrose is 75%. It works in some cases like this, and this is a mix of techniques. I use dextrose 75%, polydocanol foam, and polydocanol liquid. So there's no magical formula to achieve good outcomes, and most of the time, unfortunately, you have to deal with the unpredictable. This is our training courses here in Brazil, and my email, if you have any doubts, be comfortable to reach me by mail or phone or WhatsApp, whatever you want.